Our highest demand jobs are actually right now supervisory positions. We're looking for licensed clinicians that can be supervisors, which is very hard to find. So I think the best way to prepare for that is stay in school, get up through a master's and then get onto the licensing track. But the other thing that's in high demand is language capacity. So we work here in Lynn and try to service all the families here, and so there are so many different languages spoken that any staff that have kind of different cultural backgrounds and different language capacities is in very high demand.
So right now what's in demand is we're hiring for home health aides and CNAs, companions, homemakers, and all caregiving jobs that we have are in high demand because we are growing as a company, we're getting new contracts, and we're taking over a lot of the geographical terrain on the North Shore. So a lot of these positions is something that is round the clock for us too, because the cases that we fill, means more opportunities for other health workers to come in and take on new cases. So it's round the clock, 24 hours. Right now, CNAs, home health aides are our priority. So as you know, as you are representing North Shore Community College, you do the trainings for home health aides and CNAs. So we do welcome that because it is a required piece to have those skill set, and certified you need to be for these positions. But also, as a recruiter, our team will look and see, somebody that has looked after their elderly mother or an elderly member of the family, and they have those skills, but they don't have that training. So at Associated Home Care, what we do is we'll bring them in as a companion or a homemaker. Once they've done that, what we will do is then possibly encourage them to take on home health aid classes through North Shore, through the Red Cross, CNA, or we do provide them ourselves. So we do run home health aid class, but just for staff only, as part of a career ladder that they can improve and build up to.
We're always interested in speaking to anybody who speaks another language or how many ever languages they speak. We do like it if somebody has a medical background, and there is an absolutely excellent medical interpreting program that is offered by North Shore Community College. Many of our interpreters have taken that program, and they now work with us as professional medical interpreters. Languages, of course, you probably know in this area, Spanish is number one. After Spanish, Portuguese, Russian, Haitian Creole, Vietnamese, Khmer, which is Cambodian, Italian, Albanian, the list goes on. I'm always looking for Japanese interpreters. They are few and far between. Rate of pay is very good, although I don't discuss that publicly. And if somebody is interested, we'd love to have them come and have an interview and really talk about what their goals are.
So at Sunrise, in my role with recruitment, I'm always hiring for certified nursing assistants or home health aides, as we do care for the elderly, and we do require somebody that has a license for a CNA or home health aide to do so.
I think they can put their best foot forward by really researching the position they're applying for. So really kind of understanding, going to our website, understanding kind of what the role is they're applying for, researching more about the agency. So they kind of come in with questions. That always stands out if you can tell they really are interested and have read up on the agency and the position. I think that's putting your best foot forward. Also organization, kind of coming with a copy of your current resume, not confusing us with another agency you're applying to. Just kind of being organized, making sure you show up a little bit early for the interview, I think is helpful, and kind of outlining any questions you have and stuff like that. I think also best foot forward is just having a real passion and commitment to the families, children and families who we work with, and the community. It always stands out if someone really is connected to Lynn or really wants to work in Lynn versus just, I don't know anything about the community. Right. I think that really stands out to us.
Okay, so if anybody is interested in Associated Home Care right now, best thing I would suggest they do is apply online. I know a lot of candidates will say, well, we didn't hear anything. So the next thing I would say is be persistent. Follow up on your application. A lot of people that do stand out for us is people that follow up and say, look, you know what, I sent you my application, it's been a week, I haven't heard anything, I just wanted to follow up. That brings focus and attention to you out of the 300 people that we have. You kind of stand out. You've made that connection. So then, we bring them up, we see the resume, before you know it, we have an interview, and the rest could be history. So you're trying to think outside the box. So I say those who are persistent, well presented, do very well in their interviews, even follow up and ask for feedback after, you know, say, well, why didn't I get this position? So we're trying to build good rapport and relationship with our candidates to make that experience a more pleasant one. It's not about just receiving rejection letters. It's not about saying that, I'm sorry, you didn't quite fit the skill set. We'll say you didn't because you don't have any certification. However, if you come in, Homemaker Companion, and then do the training with us, that's a step up to being where you want to be, but you'll have experience. So we're kind of versatile like that. We've had a lot of people I've experienced in the past, especially for interviews. Lately we've noticed presentation is key. And a lot of people don't make an effort. When you walk in that door, make eye contact, shake their hand, look very smart and presentable. You know, we've had people come in jeans, people come in sweats, t-shirts. It's something that says to you that, you know, would I want my grandmother or my grandfather to be taken care of by a candidate that hasn't really made an effort at even point of interview?
Right.
So, you know, employers, we're very judgmental, but all for the right reasons, because we are filtering different characteristics, personalities and traits in individuals, and we're meeting so many of them at the time. It's what makes you so special, how you stand out, and you're competing with a lot of other applicants. So it's something you want to, you know, have on board and think, you know, how can I stand out? What can I do a little bit more different? Or if I have competitors, how I can just be on that little bit of an edge than everybody else.
I think probably the best way is if they send us an email. The email address is info@medinterpreters.net. info@medinterpreters, all one word, .net. I would like a resume. I would like 2 references. They don't have to be written. If they want to provide a name and a phone number, I'll be happy to give the references a call. I need immunizations. To go into a hospital, any kind of a healthcare plan now, you have to have your immunizations in order. Probably the most important one is tuberculosis. If I get a resume, I will give the person a call, personally myself, and I will set up and talk to them a little bit and set up a time that they can come for an interview.
As far as that email or website you provided, they can get that at Career Placement Services at North Shore.
Yes, we're going to be in touch with them. I met some of them today, and they will have all of our contact information.
Great.
One thing that's important to me, we often do group interviews, and we do a behavioral type of interviewing, which means when I speak with the interviewers, I say, tell me what you have done versus what you would do, so that way we know what you have done to prevent something or to deal with a difficult resident or client or coworker in the past, so we know what you would do in the future. Someone being quiet during a group interview, I don't think is a good thing. I think that your goal is to kind of stand out amongst the other people who are there. Coming prepared with the copy of your CNA, a resume is a big thing to me. References, asking questions, not just listening to what I have to say, but giving me your input as well. Those are very important things to me. Using my name, that's very important, that you're aware of what my name is, and when I ask you questions, you respond to me, Katie, in that sense. So those are some important things for me when interviewing. One thing is timeliness. Timeliness is huge. I don't think that coming to an interview that's at 11 a.m., getting there at 10:58 or 11:02 is appropriate. I think you should come 15 minutes early. You should be prepared. When I walk into where I'm going to interview you and you're on your cell phone, that's a turn off as well. You're not really in the moment. You're kind of worrying about what else is going on. Again, someone who's not interacting, not asking questions. I understand that people are shy and not everybody is very outgoing, but it's important, I think, to ask questions and really know what position you're getting yourself into. Sometimes people can come off as sounding kind of desperate, like I'll do anything, give me any job, and it's that can be a turnoff as well for an employer. As you want to know that, especially with CNAs and home health aides, it's such a valuable, important job. It's not a job you can do for just a paycheck. So I think it's very important that you're there for the right reasons and you're not there just because you desperately need a job.
Yeah, so I'm one of the career pathing people. I started off as a care coordinator years ago, 11 years ago, which is kind of a direct service job doing wraparound services, and then moved up to become a supervisor for care coordinators. and then became the director for the program, the wraparound program, and now I'm the site director for the Lynn site. So I've kind of steadily moved up in the agency. And we have several staff who, some of our staff have started off in more kind of paraprofessional roles. We have a role called a family partner, and several of them are still in school. So they're actually, some of them come to North Shore or other schools, and they're continuing their education, they get their degree, and they move into another role. So we have several staff who have been able to do that. We offer some part-time jobs, so people that are kind of full-time, then they drop to part-time while they're in school. They can do internships and they kind of come back up to full-time. So there's a lot of opportunity for people to move up, take on different roles.
It's been run like a family business. It's been since 1991. So it has that rapport, and it's part of their culture and part of our mission. We're not corporate, so we like to nurture skills. We like to see opportunity for growth. So we have a lot of schedulers, like our vice president of the company started as a scheduler. Yeah. She came in, she was doing scheduling, she's been in the company for a long time, and now she's the vice president. We have management positions, we have office positions. It's not just healthcare as well. We've had, for example, some of the CNA home health aides that we've hired are now gone back to school and become RNs and LPNs, and they work for us. They're part of training. We have special departments with which we have some of our nurses and our CNAs that participate in training for new staff coming in. So there's a lot of opportunity to growth for training, and we try and identify skills and in people that really make them excel.
I think the best way that interpreters can grow, number one, their language skills are good. I'm not saying that they need to have a PhD in English or Romanian or Moldavian or Spanish, but you have to have language skills good enough so people on both sides of the table can understand it. Providers understand your English, and the patient understands your target language, okay, which whatever that would be. Customer service is a must. Nobody has to get a new wardrobe from Brooks Brothers, but you have to be neat, clean, and presentable. Personally, I don't want to see any tattoos. I don't want to see any rings in the nose, okay? You can wear those to the appointment, put them in your ashtray, and put them back in when you leave, okay? So again, customer service is huge. You have to know how to interact with people to make the patients feel comfortable. When people go to a medical appointment and they don't speak the language, it's normal for them to be nervous and afraid. So as an interpreter, you have a lot of power in making the environment safe for the patient. You also make the environment work for the provider, so you can manage the flow of information back and forth. You never delete anything, you never add anything. You're there as a conduit for clear communication.
One thing about Sunrise is that if you want to grow and you want to, keep with Sunrise, you're going to. If you want to, and you show the initiative, you're going to. So as a CNA, there's several different things that can happen within 3 to 12 months of your career. One can be going to be a medication care manager, which is somebody who administers the medications to residents, a reminder and things of that nature. Also, there's a lead care manager who is a supervisor on the shift. And that's an opportunity that you can have anywhere from 3 months after you're hired to a year. After that, the coordinator position is something that, I have a staff member in Peabody who's been a lead care manager, and now they're working to mold her to become a coordinator once a position opens up. So I have a GED. I don't even have a high school diploma, and I now have the opportunity to be an executive director within the next 9 to 12 months. I started working there in November of 2007, and I just recently had my 7 years. I started as a certified nurse's assistant. I went on to be a business office coordinator. I then went on to be a resident services supervisor, and then I've been in multiple coordinator positions, and recently got approved into the executive director and training program this past month.
Oh my goodness.
College is a wonderful thing. It just, it wasn't the way I went, and Sunrise has their own university, which I grew within, and it's been, it's been a wonderful experience. But there's many success stories. If you go to different Sunrises and you speak to different coordinators, there's many success stories within Sunrise.
So there are entry-level jobs for people that don't have a degree yet, is the family partner role, which is part of our wraparound program. So family partners are hired for their life experience, being a parent and raising a child that has some type of special challenge, so whether it's a mental health need or a physical challenge. And so they're hired because they've gone through their journey of trying to raise their child and find resources, and they're hired to support parents who are in the middle of their journey right now. So that role, a lot of our family partners are working on a degree or not even in school, but they're hired for their life experience. And the other role is therapeutic mentors. So mentors does not require a degree. Some of our mentors have degrees, but some of them are getting their associates or working toward that. And those are kind of a one-to-one relationship with the child, mentoring, with a little more of a therapeutic tilt to it. So they have goals that are established by a clinical hub who refers to them. But that's another opportunity for someone kind of entry level.
Well, the benefits is, we're very competitive salary, we have great pension, a lot of continuous training, opportunity to grow, and it's a different culture. It's not a corporate setting, it's a family-based setting where you learn values and morals set back right down from family and generations. We're proud to make sure that our caregivers are rewarded, because without them we wouldn't exist today. So their happiness is key, supporting them is key, training them and keeping them constantly invigorated in an environment that's very tough. You lose loved ones because they're an extended part of your family. You want to make sure that we are there as that second backup, as their family, that they can come to. So it's a great environment to work in. And I think for job seekers, I would say, be persistent, think outside of the box, always have your contact information, resume, whatever information you need to pass on to employers to get to you. Be persistent, follow up on all applications, and don't give up, just keep trying. Presentation is key. Social media and networking is key.
We treat our interpreters with a lot of respect. We know that they work very hard and they're dedicated, and so we treat them with respect, we love them, and we give special trainings twice a year at Beverly Hospital, and we charge a very low rate, and they get to listen to professional doctors, nurses, medical interpreters, people talking. So it's a great thing, and people love it. And they get a beautiful certificate with a gold seal.